As of now, how have findings from comparative effectiveness research been significant enough to positively impact patient safety?
Well, the short answer to that is I don't think that they have as of yet. I think that the field is still burgeoning, and I think that we have a lot of information that's already out there, and we frankly need head-to-head comparisons in order to move that forward, to compare safety and efficacy in patient populations and then start looking at cost.
Okay. What are some of the challenges and opportunities in communicating CER to healthcare stakeholders?
I think the biggest challenge is not that the information can't get to physicians, but there seems to be a bias or a step-off when we as physicians get that information in terms of incorporating that into clinical practice. And then the second part to that is in patient empowerment. You know, the patient is really the central figure in the healthcare system. That is the ultimate consumer, if you will, and that patients need to have this information. And I think that there's an asymmetry in the dissemination of information, whether it's from industry or from counter-detailers or from the federal government. I think that those asymmetries need to be addressed and overcome. And then certainly, ultimately, we need to educate the ultimate end user of the healthcare process.
What do you think it will take to overcome the asymmetries?
I think that we need to level the playing field to a degree. The industry has extreme regulations on what it can say and what it cannot say. I, as a physician, I am allowed to use medications that are for off-label uses, and I think that it would be nice for me to have the ability to speak to the industry personnel in order to get that information. But I can't do that right now. I can ask them a question, of course they can't answer me. And I think when it comes to counter-detailers, they have no regulations. So the government has invested millions of dollars into promoting employees who are healthcare professionals, pharmacists and nurses and the like, to come out and then tell me that I should be prescribing agents that are perhaps cheaper. And there's no regulations whatsoever. So I think that the regulations that are currently in place on industry need to be loosened a little bit, and then they need to be, whatever regulations are left, need to be on par with the regulations that are going to guide the government in their interactions with me.